Good morning, good afternoon, good evening, wherever you may be. I am Wolf Kirsten, the co-director of the Global Center for Healthy Workplaces, and I'd like to welcome you to our webinar, Enhancing Physical and Psychosocial Wellbeing in the New Working World. And we're really very fortunate and very glad to have two of our global awards finalists, GlaxoSmithKline and HSBC today. And I will explain a little bit as a first step. I'd like you to get an idea of, for those of you who don't know, what our awards program is about, and just a very quick brief on the criteria, because I think that's important to put it in perspective. So we'll start off, or I will start off by showing you just two slides, and hopefully you'll be able to see them.
Yep.
Okay, good. So the focus or the scope and the framework of the Global Healthy Workplace Awards are the World Health Organization Healthy Workplace criteria. So here you see the Healthy Workplace model, and I know quite a few of you who are participating are familiar with this model, and it is fairly comprehensive. I think I won't go through the four areas around the outside, but it really is, with wellness, occupational health and safety, your psychosocial factors, and also, which is becoming more and more important, the role the enterprise is playing in the community with regard to health and well-being. And it's very important that as an employer, you follow a continual improvement cycle, make sure you're addressing the needs of your employee population, and after running or during running your program, evaluating and improving. So that's really as brief as I can make it. And maybe one last comment on this model, as you will see in the very center, of course, ethics and values are always or should be at the forefront. I think that's very important, kind of along the old adage, do no harm at a minimum. And of course, you need to engage your leaders just as you need to get your employees and workers involved from the get-go, actively involved. So we have seen that through our awards applications that the companies who score higher have done this very well. So that's kind of the main message here. And our awards program, the Global Center for Healthy Workplaces, has been running it for 8 years. We're in a 9th year. And here you can see some of our past winners. And as you can see, we're very glad to have both GSK and HSBC here today, because they were the finalists in the last year in the multinational enterprise. So as you will know, these are multinational corporations running programs all over the world. So that's fascinating in itself. And you may recognize some other companies here, and I know some of you are actually online, so joining. So thank you for that. That's always great. And I should mention, we do have a certification program linked to it for companies who apply and reach the threshold of these criteria. They receive a Healthy Workplace certification. And finally, I think important to mention, the awards are open right now. So until June 15th or 14th, I think, companies can apply, and you will see all the information online. And by the way, it's a very transparent process. We have 5 judges from 5 different continents judging the applications. So I'm going to slowly get out of the program here and hand it over to my partner, Tommy Hutchinson, who is the co-director of the Global Center for Healthy Workplaces, and he will lead the discussion. Thank you, Tommy.
Thank you very much, Wolf. So I'm delighted to play host to this session, which will be looking at enhancing the physical and psychosocial well-being in the new working world, whatever that may or may not be. And for GSK, we have Sharon Wilkie, and for HSBC, we have Tim Eldridge and Olivier Pratt. And I will just like to, perhaps I will start maybe with yourself, Sharon, looking at the office environment and so forth. Could you share with our audience, please, today, what kind of plans are you making for hopefully a possible return to work, whatever that means, at least the physical work, and what kind of physical changes might you be making to the office environment?
Sure. So as mentioned, we operate all around the world. We have 100,000 employees in over 100 countries. So as you can imagine, there is no one blanket guidance. What we've done at GSK is we have an issues management team globally, and each country has an issues management team that is managing the COVID situation. So we put together global guidance, but of course, the countries have to take that and they have to merge that with the local public health guidance and come up with their own plans. Generally, though, we have workers, for example, in China, they're fully back in work. And of course, our manufacturing environments have been on site throughout the pandemic with, appropriate social distancing and PPE in place. I think one of the more interesting things we've done since COVID is we've put in place what we call performance with choice. So as part of everybody's development planning this year, they had a performance with choice conversation with their manager about how they want to work, coming back to the workplace, not coming back to the workplace, some kind of hybrid model. So really talking about what works with them and what kind of flexibility they need to be at their best, both at home and at work. I think in terms of some examples of coming back to the workplace, I can just give you, like I said, it's different from every country. But for example, in the UK, we have brought back only those workers who cannot perform their normal work duties from home or are key to getting the medicines and products out to patients and consumers. When they come back into the workspace, they have mandatory online training they go through. They have to book a desk or a space in advance. They have temperature checks at the door. They're required to have face covering, use social distancing. And of course, we have limited amenities open in our headquarters in London, the restaurant, the beauty shop, some of the stores are closed, etc. And then, of course, all what you would expect in terms of sanitizer and deep cleaning. But again, with a global company, it's got to be a global recommendation with very local solutions.
And Sharon, would you perhaps just describe your own role for our audience?
Sure.
Broadly, what is the remit? I should have asked that at the beginning.
Yeah, no problem. So I lead our global health operations, which is basically any of our programs that are really global in scope. Our function, EHW, Employee Health and Wellbeing, encompasses occupational health and health promotion, if you will. But of course, health and well-being at GSK is much larger than that. It starts with our leaders, EHS, our HR, our facilities, our training and development. We all work together to create a healthy and productive culture. So it's not just our function, but yeah, my role is in global health operations.
Fantastic. And Tim, could you again do the same, and perhaps Olivia just after you? And of course, HSBC has been in the headlines in the newspapers about how your executive are restructuring their offices, and perhaps you might elaborate a little on that too.
Yeah, thanks, Tommy, and I'm sure I'll touch on that in due course. So hi everyone, I'm Tim Eldridge. I'm the Global Head of Health and Safety for HSBC. Again, a very large dispersed organisation with around 220,000 employees in around 60 countries across the globe. And I will talk a little bit about what you talked about, Tommy, but I also want to introduce Olivia as well. And just to put it into context, when we entered the awards last year, which was a great experience, by the way, so if you're thinking about doing it, make sure you do it, is we actually decided to focus particularly on one particular aspect of our wellbeing program, which is around food and nutrition, which Olivia leads for the bank. So, as we start to talk about, return to the work, clearly how we deliver the sort of nutritional catering offering to our people will be really important. So just want to do a quick introduction, Olivia.
Yeah, thank you, Tim. Yeah, I think that's a good overview. I'm also a registered nutritionist in the UK, based in the UK, and yeah, as Tim says, my focus is very much on Eat Well, Live Well as a programme. It's a global diet and health programme for our employees. Yeah, so my focus is very much on how we welcome employees back to the different dining environments that we have within our sites and offices globally, and how do we ensure they're a healthy healthy options in place, and not only encourage them to adopt healthy habits as they return to work, but equally over the last year and for the coming months, however long it might be, how do we encourage them to do that whilst at home too? So yeah, my focus very much on global diets and health.
And just to add to that, just tell a little story, because we actually had an event today, which was in honour of Stop Food Waste Day, which I think was yesterday, Olivia. So clearly, you know, physical well-being is really important, but that whole sustainability and food waste is a big issue. And so we had a food fight cook-off between two of our chefs. They were given a bag of unknown food waste to make the most attractive dish, and so we've just come off that call. It was great to see, you know, and it was done remotely as well, but in the kitchens, how you can make some great nutritious food for give our people ideas. But anyway, I thought it was quite interesting.
That's good. and what kind of plans are you making? Of course, you've got, you know, entire branch network and the head office and so on, and regional offices. What kind of physical recommendations are you making for their physical return? How do you handle that?
Yeah, well, certainly when Sharon was speaking, I was, if not noticeably nodding my head, I was absolutely nodding my head. The approach is very much the same, and really importantly, we have to recognise that, you know, the circumstances differ from country to country, from region to region, whether that be, for example, in China, where or Australia, where the virus is very well controlled, and we can be very comfortable in having people in our offices without too many controls, through to such places as India at the moment, where we've got, you know, several thousand employees clearly having a very difficult time. So, as Sharon said, we very much, from a global point of view, provide the expert medical and scientific advice to the country, but they will make their own decisions based on the circumstances on the ground. But you know, when it comes to return to the workplace, one of the things we've been very clear about is we don't want to sleepwalk back into the way that we were working before we started. Now, you know, it's been a very difficult time, last 15-16 months, but there will inevitably be some benefits of what's happened, even though they will not outweigh the real tragedies that have taken place. And one of those is, of course, to have a different way of working. And one of the things we're absolutely going to focus on is that, you know, the workplace is very much a place to collaborate, to network, to work together, to be productive. Not just for someone to go on a train or a tube or into an office and sit in front of a screen like they did at home and just do the exact things. That's not what the office environment is for. So very much focused on that. Right, and that is actually quite a potentially radical change from how we all used to work before. So that's very and just a follow up to both parties, so to speak. Are you finding that because you have to send messages out and so forth to your networks, are you finding that they're well understood, or are they people coming back and saying, oh, we don't understand what you guys in head office are saying, you know, this is too confusing? What kind of feedback are you getting from your colleagues in the ground? Maybe Tim, maybe you could just follow up, and then I'll go back to Sharon on that, or Olivia. Yeah, and I think the first thing I'll say is, when we particularly talking about the pandemic, and you know, however many years, and it's been a lot of years that I've been involved in occupational health and safety, I've never been in a situation that I was faced 15 months ago, not just with the scale of the let's call it the crisis, but also the fact that we were dealing with an unknown virus. And it was called novel coronavirus for a reason, because it was novel and new. So, you know, first and foremost, we made sure we had the best advice, and so we had, you know, expert medical advice from, you know, experienced doctors in infectious disease, who very much led us in developing that central guidance and advice, albeit having, you know, that has changed very much over the last 12 months, as we've learned. So we've done that, and it's a test and learn. So we write guidance, we send that out to the regions, the countries, and they feed back. And if it doesn't work, we adjust it, or as the advice changes, and as a health and safety professional, I'm not used to advice changing. You've got to confide to face, kind of know how to manage it, right? But when you've got advice which is, oh no, you don't need to wear a mask. Yes, you do need to wear a mask. Oh, you can only be infectious if you've got symptoms. Oh, actually, we now know about asymptomatic. It was quite dynamic and quite unusual for me. So having that test and learn approach was quite useful.
Absolutely. Sharon, does that resonate with you?
Yeah, absolutely. Same type of approach. I mean, we have our physicians sitting on the central IMT, and very, very thoughtful documents coming out in terms of guidance. There is a COVID website where managers can come in and pull information. There's frequently asked questions for employees that's written in a very easy to understand language. And when recommendations go out to the countries, within the countries, if we have physicians in the countries, they're sitting on that IMT, they can help out there. If not, we have regional support. And if there's any questions, there's a very clear cascade and escalation process to come back. If we had to change guidance, there was a process to do that. So I think it was quite organized, and actually we mobilized very quickly, and it's worked fairly well.
Thank you. And Sharon, we all probably are in agreement that home working of some sort is likely to continue, maybe forever. What kind of advice, what kind of support do you give people who are going to be working at least part of their time at home? What kind of guidance and support do you provide?
Yeah. I think, first of all, in terms of the home office, I mean, you have two aspects of it, right? It's kind of the physical and the psychosocial aspects of working from home. I mean, clearly we have ergonomic standards that apply for home as well, and people can do an online assessment. We also provide some reimbursement, and it's country by country in terms of what the guidance is for setting up a home office. But, you know, clearly there are people in situations where they don't have a space to set up a home office. You know, people are working at their kitchen tables or dining room tables. So we're conscious of that as well. But the ergonomic assessment and the ergonomic support is there. I think from a psychosocial standpoint, you know, we are encouraging employees to continue to be physically active. It's easy to get caught up in, you know, you come from your bedroom to your kitchen, you make your coffee, you go to the office. And, you know, we're trying to encourage employees to do their commute to work, you know, to go out and take a walk to work, walk home at the end of the day. Not only is it physically healthy, but it sets those boundaries, right? You kind of have those transition points. And from a psychosocial standpoint, you know, you have the transition point between work and home. And, you know, early on, we found it was easy for employees just to get caught working all the time because work was always there. So I think that's really important. In terms of health and well-being programs, I mean, we were already well down the road on a technology engagement. So we have our Healthy Life platform where employees, it's accessible to about 50,000 employees. So about 50% of our population has access to Healthy Life. And in the US, another 15,000 have access to our Rally platform. So we have a good majority of our employees who have access to online engagement. They can do their health risk appraisals, participate in challenges, track their healthy habits online, and we're continuing to promote and encourage that. But we've done webinars, and other online resources are available. And I would say the last thing we've done is one of the biggest issues I know we all have is childcare during this time where people were being homeschooled. So starting in March of last year, employees are eligible for up to 80 hours of childcare per family, and they can spread it out as they need it. We renewed that for this year and also added that you can use it for a private tutor for kids up to age 12 if you need be, so that people can have a productive work environment at home.
Great. And I used to work at NatWest Bank, and I cannot understand how one can run a bank from home. So please enlighten me. Our competitors at the time, HSBC, Tim.
Yeah, well, Olivia. You can. I mean, I think at the height of the pandemic, we had 220,000 people working from home, and maintaining our services to our customers and clients. I mean, I'm not going to say a lot about that, but I mean, technology, I mean, if it'd been 10 years ago, right,
Yes.
it would have been impossible. And you know, I do shout out to our technology friends who, you know, I thought in health and safety I got a bad name until I realised that my IT colleagues tend to get equally bad rep, but they've just pulled, you know, been absolutely brilliant to be able, and I'm sure in every organisation what they've done. And just to pick up on build on what Sharon said, and very much, you know, HSBC doing very, very similar things. But I think if we just focus a little bit on our Eat Well, Live Well programme, you know, it very much focused on the fact that every day we would probably feed, I think, Olivia, around 140,000 people in the workplace. And in March last year, we were feeding almost 0 people in the workplace. So we had to do 2 things. And Olivia, do you want to explain what we did with the programme, both for our critical workers in the office and then obviously for the majority at home?
Yeah, absolutely. Yeah, I think like Tim says that historically pre-COVID, the focus for the programme was very much on how do we encourage those 140,000 people that are eating with us to opt for the healthier options that are available. And one of the main KPIs of that programme was measuring the impact and looking at the sales of those healthy items. So when we found ourselves in the situation we were in 15 months ago, we were fortunate that the programme was in a great position to adapt to supporting employees as they work from home. We have a global diet and health website, which had already been in place, and that gave us that opportunity to actually continue our online engagement with employees. So that website it's a hub of articles, it's recipes that are contributed to by our chefs all over the world, videos and health tools so that people can look at things like their BMI and their waist circumference, those types of things. So there was an awful lot of tools available, and actually then it gave us that opportunity to build on those last year. And I think one of the other ways we've done that, as Tim mentioned a little earlier on, was by running virtual events. So again, as we had less influence and we had less data about what employees were eating whilst they were at home, as opposed to when we used to have a bit of a better picture in the workplace, how could we encourage employees to keep that as a focus as they worked from home? As Sharon was saying, it's so important to do that commute, that walk, but equally making that time to make a healthy lunch, or think about what they were cooking in the evening and ensure that they had leftovers ready to heat up the next day. So the virtual events we've done with our chefs have been great. They've been really popular, and we've tied them to different world event days, World Health Days, as Tim says, Stop Food Waste Day this week, but World International Women's Day, World Sleep Day. Tying in those relevant messages and encouraging and inspiring employees as they remain at home to make that time for themselves in the kitchen has been one of the ways we've interacted with them.
Now, thank you very much for that, Olivia. And now both GSK and HSBC, you're both painting a very rosy picture, if I may say so. But I think we all know that there was a great deal of, probably, generally speaking, a lot of mental stress throughout all the period of change and so forth. Employees, I imagine, in pretty much every company in the world went through some kind of stress and all kinds of problems. You know, suddenly they have to work next to their family and so on, which may not be all that easy and so forth. Could I, how did you assess that, and how do you continue to assess those mental well-being issues, the psychosocial factors, and what kind of problems are you encountering? Maybe not so much are you still encountering, and how are you looking to kind of resolve those? I'll start. Well, whichever would like to go first. I'm easy. Sharon, would you like to try?
Sure, I'll jump in. So, we were fortunate in that we have a good assessment program. We've had a good assessment program in for many years. And I would kind of say there's 3 tiers of where and how we assess. The first tier is in those countries where they have a mandatory assessment and they have a specific tool that you must use. So, for example, in Mexico, there's the NOM 35, and you have to use the tool that the government provides. So we have actually integrated that into our platform. We have our third-party vendor that processes them, and we have that integrated in. Where there's not a mandatory tool in our healthy life countries, we have an organizational stress assessment integrated right into the HRA. So when employees answer questions, we get the results there. So that covers, about 50,000 employees. And in the other countries, we use the UK's HSC assessment tool, and we have a third-party vendor that processes that for us, so we can use that. And when I look across what we're seeing, I don't think it's changed a whole lot in terms of what we see in our organization. We do well on manager support. We do well on fairness and respect in the workplace. I think job demands and job effort. I think it's become harder to do work through the pandemic. It takes more effort to reach out, to connect with people. So that's where we see the issues coming through. The other thing we look at on a regular basis is, of course, our EAP and the presenting issues that come in through the EAP. And there, we clearly last year saw a steep increase in parenting issues and family relationship issues. And we're seeing that kind of go back to anxiety, worry, things like that, which we typically would see in the EAP. But parenting and family issues definitely came through last year with the pandemic.
And that must be, can I just pick up on that one?
Mm-hmm.
Because I imagine pre-pandemic, you maybe didn't have to deal with family issues and personal issues like that. Is that something that's changed in the way you perceive your own role now? I'm not saying you give personal counseling or anything, or maybe you do, I don't know, but is that changed, that you're kind of your remit in a sense?
Well, no, it hasn't really changed the remit. I think GSK has always had a rich, resource to support families. I think we just saw the calls coming into the EAP pop in that area. But for example, in the US, there's kits available for different age groups, and we saw, a lot more demand for those types of services. So I don't think it's changed the remit at all. And again, I think we're seeing those issues kind of return to what we saw pre-pandemic. Interestingly, we thought our EAP utilization was really going to increase a lot during the pandemic, and it actually went down ever so slightly. And our provider said the whole book of business went down. And their theory is that people were very focused on just the physical well-being, physically staying safe, hand sanitizer, masks, do you have to wash down your groceries when you bring them in? And then kind of in the third quarter, we saw that mental fatigue from the pandemic. You saw a little bit of a bump there. Right. But yeah, no, I don't think the parenting issues, I think as kids have gone back to school, I think things are returning. We're starting to see the data return back to the typical things, anxiety, worry, things that we would normally see through the EAP.
Very interesting. Thank you. And Tim?
Yeah, I think to build on what Sharon said, there's probably 3 things that I'd add or collaborate with what Sharon said. First one is very much ask your people how they are feeling. And particularly during the pandemic, when clearly, we've always had staff surveys and ask those sorts of questions, but, we've tailored our surveys to be very much focused on asking people how they're feeling during the pandemic, and also more equally as importantly, how they're feeling about post-pandemic coming back to the office. And so that's the first thing. And certainly one of the things we asked them about was nutrition. And Olivia, I think we've some of our resources very much focused on supporting there's a clear link. Well, you know better than me the link between, nutrition, diet, well-being, and some of the things that you've done in the programme.
Yeah, absolutely. Like you say, there's certainly a link there, and it's a link that we can work with just between physical and mental well-being. Obviously, there's lots of research now around the link between food and mood. But yeah, as Tim says, that piece around the wellbeing surveys that have given us that rich data about employees' self-perceived scores on their diets, on things like their sleep, on their physical activity, and again, more widely around their mental well-being, has helped us to steer our approach and the topics and the events that we focus our efforts on and make available to employees.
Right.
Thanks. And the second thing I was going to mention, and again, very similar to Sharon, is support. So, though increasing both the availability and the awareness of the support mechanisms, whether that be, our global EAP program, which is very much tailored for the locality of where our people are, but also, colleagues of mine have developed, online resources, not just for employees to be able to understand their own mental health and their own well-being and how to address that, but I would say arguably more importantly for line managers to identify the challenges that maybe their team are having. And we've always talked, haven't we, in the past about being eyes on your team, and you'll be able to spot if someone isn't really doing very well. Well, I don't know about you, but when you're on a Zoom call, I'm not quite sure it's that easy to spot. So giving our line managers the tools and encourage them to really ask the right questions. And then the third and very quickly just say, Tommy, is that we've also had, obviously throughout the last 15 months, critical workers in our offices, whether that be our branch staff or some critical workers in our offices. We are also defining people mental well-being as a criticality factor for being in the office. So if someone is very much not not in a good place and working from home, going through the all extreme, whether that's because of their environment or the people around them or some of the threats they're facing, clearly the workplace is somewhere we would encourage them to be, and that becomes a criticality as part of being in the office.
I'm glad you've raised the issue of managers, because we know that that's a really strong determinant in whether or not you're happy and productive and so on, is the relationship that you have with your boss. We also know that bosses are not all, sometimes they get into that position for other reasons, and well-being is certainly not often one of them, or the understanding of well-being. Certainly, I know some of my own days in the past that was the case. What kind of advice, support, what you expect from managers who are managing teams of people in this space? I mean, how do you help them to prevent things like, putting too much pressure on employees, causing burnout, fatigue, all of those things? And again, maybe sticking with your HSBC on this, and then I'll go over to Sharon.
Yeah, it's a really interesting point, and again, slightly exacerbated by the remoteness and between the manager and the employees. As a manager myself, I'm pretty sure that I've not got everything right in the last 15 months for my team. But what our mental wellbeing team have done is put in, again, a lot of resources, online resources, signposts, and support to encourage managers to use the right techniques to check in with the team, whether that, you'll have probably heard about, virtual coffee mornings, or, just not, the temptation when as a manager, when you've got your team in front of you, as it were, on a screen, let's get straight down to business, let's crack on, where are we with this project, this program? But, having that, separate time to check in, to engender that social interaction that we lose because of our remoteness. And it's different for everyone, and I think it's important that we don't try and have a one size fits all, because as you know, leadership styles are very different, and we wouldn't be a successful organization if we had leaders who were all exactly the same. So it has to be tailored to that, but providing the resource, but listening to the people and asking them how they're feeling. That's it, isn't it?
Right. And Sharon, would you like to come in on this? And this training, do you foresee, very specific question, do you foresee the training that managers have to go through? Do you see that changing over time on this area?
Yeah. Again, I think we're fortunate because this was an area we were focusing on before the pandemic. So we do have a Mental Health Matters manager training that's a 4-part online training. And it focuses basically on the things that Tim is talking about. How do you have good conversations? How do you start a conversation with an employee when you sense that they're struggling? How do you even spot the signs and symptoms? And I think, the biggest thing for me is that people have to know their team. You're not going to recognize something that's different if you don't recognize what their norm is. So we're fortunate, I think, that we have a workplace where people are, they can bring their authentic self to work, and they really do know each other in the workplace. So that's the first step. But we do have the formal manager mental health training. We also have integrated into our first line leader training a section on resilience and team and leading health and well-being. And we're just developing our TL and OD group, a new second line leader training, and it's going to be divided into 4 modules. So focus, motivate, care, and develop. So the whole care section, there's a 4-hour care section where we talk about health and well-being, inclusion, diversity, a whole variety of things. So that's already built into our formal training, if you will, Tommy. But informally, we have tips for having conversations. We have a leader's guide to health and well-being. And it's really about just connecting with employees. And as Tim said, making sure that you're asking them how they're doing, and maybe asking them more than once, because as we all know, how are you doing has become just the normal way we introduce, and everybody says fine. So really, how are you doing? How are the kids doing? How's your spouse doing, etc. And really having some good conversations.
Great. Livy, do you want to add anything to that, or? Your boss is fine.
Less so on that line manager piece, I guess, but more so that it's just been a focus for us is that piece around collaboration. How can we bring employees together as they continue to work remotely? Whether that's, we've done specific team events where they'll cook together with the manager after work. And we've done that for our group sustainability team, which was great fun and they thoroughly enjoyed. And it's also something we're working on to launch in the next few months, is this idea of an Eat Well, Live Well team challenge, whereby employees will get together, whether it's remotely, particularly in some countries where we haven't returned to the offices as much yet. And that will help to bring employees together and discuss, like you say, those different topics on physical well-being and diet and exercise, and promoting and inspiring each other to adopt some of those healthy behaviours.
So the key message I think I'm taking from all 3 of you is that to encourage your managers to talk to their colleagues perhaps in a slightly deeper way than before, but of course, no doubt there are certain boundaries around that as well.
Absolutely.
So great, that's fantastic. I would just like to say to our audience, which is I've been observing, I will be opening this out shortly for questions. So you can post your question on the meeting chat, or signal in whatever ways team allows you to do. And my colleague Wolf is also monitoring that. So we'll try to broaden this out shortly. You both work for global companies. Sorry, all 3 of you all work for a global company. And you've all mentioned the difficulties, because very, very complex breadth of cultures and so forth. How do you, to what extent do you provide streamlined, this is a GSK view, this is the HSBC approach, and to what extent do you allow that local diversity, and what kind of standards do you set which are universal throughout your organizations? Perhaps Sharon, maybe you might pick up on that.
So Again, we have about 100,000 employees. 85% of those, so 85,000 employees, are in our top 24 countries by headcount. So I will say that we provide a lot more focus for those 24 countries, and that's just a practicality standpoint. I mean, we could spend 80% of our time chasing the last 15,000. So we have a global approach, but they're locally deployed. So we provide global programs that are standard. Our energy and resilience programs, the EAP, the platforms are all very much global. We also, though, have a brand hub where we have tools, materials, promotional materials, all different types of ideas on how the local markets can take and use those. So the local communicators, local health and well-being, health promotion, HR, they're pulling tools from the brand hub to promote programs locally. So we have a common look and feel. No matter where you go around the world, you recognize that's a health and well-being program, because I see the logo. They're using the same materials from the brand hub. And in terms of global communications, we also have a global Keep Growing campus, which is our learning and development resources, and we store all of our materials in the Keep Growing campus. So employees, when they're looking for something, they can go into the Keep Growing campus and they can pull that. And generally, we use about 14 languages that are standard languages. So obviously, there's a lot of languages we don't offer, but 14 languages tends to hit the 85,000 employees. And finally, we do have a health and well-being workplace. So we have over 10,000 employees who are active in the workplace, where they can go in and chat and share ideas, etc. We use our GSK News. And then we have local health and well-being champions. We have a network of health and well-being champions locally that help to carry the programs forward.
Great. Tim?
Yeah, so it's similar but slightly different. So again, very much globally, we like to set frameworks, so provide the framework for the countries to operate in. Interesting in the bank, it tends to be that, for example, a country is in effect its own business, although part of the wider group. So we have very committed and dedicated, senior managers and teams within country who do want to, take the framework and implement it, but want to do it in their way. So I use the phrase adopt and adapt. So adopt the global framework, and they need those tools to be able to then adapt that to what's locally appropriate. And I think bringing that to the example of our Eat Well, Live Well program, Olivia, I think that's, obviously in the moment it's not quite the same, but that was very much the fundamental way it was developed, right?
Yeah, absolutely. Eat Well, Live Well is a global diet and health program, and but ultimately, as we all know, there are so many different cuisines and cultures and communities that we need to, as Tim says, align the program with. And I think, as well, as we all know, there's different levels of health literacy, and different countries were on different journeys as we went to promote and launch the program. So, and we've definitely learned from that. I think India for us was a great example of that when we launched the program there pre-COVID. As Tim said, I can't remember if you said this on a separate conversation today or at the beginning of this one, but we have around 40,000 employees pre-COVID and in India, and lots of those employees were working shifts, often night shifts in some of our global service centres. So some of those obviously having a higher risk of things like poor diet. So the work that we did there to make sure that we could tailor that program appropriately to the different cultures and cuisines meant we had to, as Tim says, adopt the framework, the Eat Well, Live Well framework, but actually adapt it to make it relevant. And some of that work actually that we did there was more around how can we reformulate recipes, as well as nudge employees to make healthier choices. How can we actually behind the scenes reformulate some of those options within our restaurants to reduce the saturated fat content and increase vegetables and whole grains into their diet subtly.
Just on that, I love what the team did in India, because they call it health by stealth. So they subtly changed the recipes slightly, what without the people knowing, oh, you've radically changed my dish. I thought it was a fantastic way of, the chefs were brilliant over there, what they did.
Yeah. Great
Wow,
piece of
that's really interesting. Thank you. So I would like to open it to our participants. I see we have a question from Danielle. I can't quite see Danielle's surname from my screen, but it asks, when do you do annual checkups for executives? Do you include mental health in those checkups? And if so, can you share what you do? Sharon.
Yeah, so again, some of this is going to be country specific. There are some countries where we do executive physicals and executive checkups, but in many countries we discontinued those many years ago. We have tried to build our preventive health benefits to the point where everybody globally has access to preventive health services. But there is in some countries we still do executive physicals, executive checkups, and there is a mental health component to that. But again, that's very individual at the country level.
Great. And Tim, does it?
Yeah. So yeah, we have a provision for annual health assessments, which is either provided as to an employee because of their role, and it goes way beyond the executives, by the way. So I get it, and I'm nowhere near an executive. And it's also a benefit that employees can choose to pick from their benefits suite. And I'm sure most people on the call will be familiar with the idea of providing various benefits that employees can choose. And therefore, that annual health assessment is not only on their physical health, but also on their mental health.
Right. And if some people would like to post up any questions, please do so. I can continue to ask questions, but I would certainly like to make this as wide as possible. Whilst we are waiting, Wolf, would you like to say something?
Yeah. Hi, thanks, Tommy. I see one here on measurement in terms of what kind of indicators do you use, and maybe even KPIs, and which ones are tracked globally. Always the question always comes up about how do you measure the success, effectiveness of your program. Any insight would be appreciated. Yeah.
Tim, do you want to go first, or?
Well, I'll ask Olivia to talk specifically about the Eat Well, Live Well program, because we've got some very clear answers there. Yeah.
Yeah, great. Thanks, Tim. So our specific Eat Well, Live Well program is measured by 4 KPIs. And they're measured globally and reported on monthly and quarterly to our Eat Well, Live Well steering committee, which is made up of a number of different leaders around the bank in sustainability or wellbeing and corporate services. But those 4 KPIs, the first one is around our provision of digital educational resources and diet and health resources in particular. So we look at the engagement with those. So we look at analytics of our website, take up of our events, and things like that. The second is of the number of sites globally that we've managed to roll out our program to. It was launched within 2019, and obviously 2020 was a year where not much progress was made in the remaining countries that we had left on our list. So the aim by 2022 is to have the program rolled out across all of our cases. Thirdly, then it's the data that we were typically able to track on sales. So we would signpost and subtly nudge employees to choose the Eat Well, Live Well options as much as possible. And actually then that data that we could track once the program was launched in that country around how the average sales of those items increased was an interesting metric. And then finally, it was employee-led. It was employee satisfaction of healthy choices within the workplace, so through surveys, through feedback mechanisms, and yeah, I think they're the four KPIs that we use within the program.
That's fantastic. Sharon?
Yeah, so we kind of have two levels of measurement. At the site level, for 104 of our sites, we have our health and well-being leadership dashboard, which is kind of our leading indicators of, do you have these programs offered at the site? What is your participation level, et cetera? And so that's on a Power BI dashboard. Anybody can go in and check the sites, and we categorize them by bronze, silver, gold. At the executive level, the key indicators are, we're using definitely the EAP utilization and presenting factors. And then most of our other measures we're pulling from our health risk appraisal. And we do that for some key countries around the world. So we're looking at lifestyle risk factors. We have some biometrics. And then from a mental health standpoint, we are looking at depression, stress, sleep, and fatigue, and also organizational stress. And those get passed on a quarterly basis.
Great, that's fabulous. And I noticed that Tim has put the program from HSBC has put the program on chat at the moment. And we probably have time for about maybe one more question, or we want to
one or two more. I think that's good. Yeah.
One. Okay. Yeah.
Can you see them?
Or maybe we can take perhaps you could pick two that we could, and I'll put them both to our panel. Is that possible?
Yeah. I suggest, I like the question about initiatives for families and children, dependents. I'm sure you run those, so that's the first one. And then the other one is, which is kind of looking to the future, which is great. What do you plan to do to take your program to the next step or next level? I think two great questions.
Excellent. Yeah. Great, thank you.
I can't. When it comes to families and children, I am going to have to throw to Olivia, because I'm going to ask her to talk about little Olivia, and I'm sure she knows what I mean. But I think it was just a great event that we held. Do you want to just give an idea, give an overview of that?
Yeah, I will. I'll have to explain who little Olivia is, and it's not me. Yeah, so I think that was. I mean, we've talked about a little bit, haven't we, about the pressures that families faced last year, and it became so much more of a focus for us to offer support to employees, not just to them, but to their families. So if we're talking about recipes, how are we encouraging our employee to have a recipe that's actually suitable for themselves at lunchtime, but equally to keep their children happy and healthy on the go as they're homeschooling. So that's certainly been a focus and something we've included more of. But these monthly events, live events that we do with our chef Alex, we saw an opportunity in February half term in the UK to bring in his daughter, who was again under national lockdown homeschooling, and she is called Olivia, and she's around, I think, 4 or 5 years old, maybe 6, I can't remember, but she was fabulous. She stole the show from Alex, and it gave us a great opportunity for her to tie in some homeschooling and to talk to our employees about how they can encourage those healthy habits from such a young age. So that's definitely one of the ways we've tackled that this year.
Great. And Sharon?
Yeah, so there's a couple things. One, our Partnership for Prevention program, which is the preventive services, covers all family members and dependents. And I talked about this a little bit at the award time back in December, but most of us who work in these big global companies and are privileged enough to sit in fairly wealthy countries, imagine that everybody has access to preventive health services. And when you go around the world, you find that even if you're providing a health insurance coverage, it's not always culturally true that those services are available. So we have 40 preventive health services recommended by the World Health Organization that are provided at little or no cost to every employee and their dependents globally. So that was a big undertaking to get us to that minimal standard. And then on our Healthy Life platform, there's a flexibility to invite up to 10 friends or family members to also join the platform. So we encourage employees to invite their family members. When they join the platform, they can order a free tracking device, and we encourage them, if you already have one, order it anyways. Give it to your child, give it to your spouse, get your family members involved. Now, through COVID, I think there was just a wide variety of activities going on country by country. I know in Turkey, they were having, each evening bedtime stories. An executive or a team member would on Zoom read bedtime stories to all the kids around Turkey, and there were things like that going on all around the world that were very creative and innovative to bring folks together. And I think some of those things continue to go on today.
Great. And just to touch on the other question before we draw things to a close, what do you plan to do? Where do you go next with your overall programs? Sharon, perhaps you could close on this one.
I think at where we are now, I don't see us, I see us doing, well, two things. One is we're continuing to look at mental health. As we did with the preventive health services, we know that the mental health services are not consistent around the world. And we will be continuing to assess. We started an assessment pre-COVID on what was the level of mental health coverage at all our sites around the world. And in some countries, there's just not the professionals available. In some countries, our global EAP is the only mental health support that is available in country. So that's going to be an area that I think everybody's going to have to look at, and hopefully collectively we can raise the bar on mental health globally. As far as the rest of the programs go, we want to continue to deploy our Healthy Life platform globally. We do see the technology-enabled services is going to be a key way to go. And we will actually continue to work at standardizing our services so that employees know where to go, what's offered, and can easily access the services. Terrific. So those will be our focus areas.
Wonderful. And Tim or Olivia, do you want to touch on your future as we draw this to a close?
Yeah, I mean, one thing we absolutely know from talking to our people and also just generally is that people will be returning to the workplace and will be in a workplace. Their minds will be in a very different way to when before COVID. So one of the things we're absolutely thinking about is from the building itself, what well-being aspects of the building do we need to look at to really support our people being more confident and comfortable when they return. And you think things like air quality, lighting, potentially biophilia. So we're really keen to see, without going down a particular route, there's various sort of well-building ways to go, but we want to look at it a lot more specifically around what's best for our people and what can we do to our physical environments to make them most productive for our people, both from a work productive point of view, but also from a well-being point of view. And of course, one of the examples of that is, we know that our staff restaurants will never be the same again. So we've had to adapt already, but Olivia, we're continuing to think that, aren't we?
Yeah, no, absolutely. There's lots of work being done in that space around the future of food within my remit. And I think, that question about thinking forward or looking ahead, I think with the Eat Well, Live Well programme launched in 2019, that the focus very much then was employees being in offices. We've adapted over the last year to then focus on employees working from home. And I think the next step is, how do we have this hybrid approach where we're supporting employees that might be back in the offices, some that will definitely stay at work from home, and some that will do both. So making sure that we continue that online and virtual engagement, but equally, how do we adapt digitally within our work settings in offices to make the healthy choice the easy choice as often as possible when they come back to collaborate in offices for us.
That's fantastic, and I want to thank the three of you for a wonderful, very extremely informative and stimulating contributions. If I may say so, we would love to invite you back again, perhaps in a year's time, to see how things might have changed. So if you're up for that, we would very, very much like to have you back again. And who knows? The world we may have another pandemic of something.
Yeah, don't even say it.
So,
no.
But we'd certainly love to have you back again, because we'd love to track your progress. And thank you very much for sharing and being so open and transparent. I think it's a great. Add a few things.
Yeah, so thank you also from me to Sharon, Tim, and Olivia, and then thank you, Tommy, for leading us through this great discussion. So Just quickly, the Global Healthy Workplace Awards deadline again is the June 14th. So if you're interested, please do contact us through globalhealthyworkplace.org. So that's probably the easiest way. And you see all the information on the website as well. And our global summit, our Global Healthy Workplace Summit, where the finalists present, as we did with Tim and Sharon last year, will be in the fall. So look out for that. We're working on that, virtual, hybrid, in person. You kind of know the challenges. So we're working on that. So thanks again, and definitely stay healthy and well. And we'll see you all hopefully pretty soon. So thank you. And we'll close the webinar right now.
Thank you very much.
Thank you.
Thank you, everyone.